Hearing impairment is either deaf or hard of hearing. The difference between deafness and hard of hearing is that deafness do not have sufficient residual hearing to understand speech without special instruction and training, while hard of hearing have enough residual hearing to understand speech and learn in a regular class. Hearing impairment is not a simple inability to hear or communicate through speech. It's not the same as mental retardation, speech disorders, or learning disabilities. Having this inability has many corollary problems: the cognitive development, emotional adjustment, difficulties in socialization, and anxiety in daily experiences. Helen Keller, who was both deaf and blind, described the problem of deafness as deeper and more complex, a much worse misfortune, for it means the loss of the most vital stimulus, the sound of the human voice that brings language, sets thoughts astir, and keeps us in the company of man. A broader definition of hearing impairment is that this disability refers to the reduced function or loss of the normal function of the hearing mechanism, which limits the person's sensitivity to tasks like listening. According to the age of onset, hearing impairment can be congenital when the condition is present at birth, or adventitious when it is acquired after birth or later on. The time when a hearing impairment occurs in terms of the normal development of spoken language at the age of 2 or thereabout is another classification of deafness. When the condition occurs before the child learns to talk, deafness is prelingual. Deafness is postlingual, however, when it is acquired after the child has learned speech, usually at the age of 2. A deaf person cannot use hearing in various aspects without special adaptations, mainly the visual mode, because they rely more on visual stimuli. Hearing aid amplifies sounds, but still are unhelpful as they can't communicate with their ears alone. Speech for them is accompanied by visually perceived actions. In general, a hard of hearing person has a significant loss of hearing sensitivity, but they can still hear sounds, respond to speech and other auditory stimuli with or without hearing aid, while a deaf person, on the other hand, relies more on visual stimuli. The anatomy and physiology of the human ear. Audition is the act or sense of hearing. Ear is the lead sense organ to perceive acoustical energy. Acoustical energy is transformed by audition into a form called mechanical energy, and finally, into neural energy or nerve impulses interpreted by the brain. Neural energy is the language of the brain. Hearing is natural and automatic for most, but hearing impairment is otherwise. The ear has 3 main parts that extends to the central auditory nervous system in the brain, which are the outer ear, the middle ear, and the inner ear.
Have you ever wondered how sounds make their way from the source all the way to your brain? Take a trumpet, for instance. When it's played, it makes sound waves in the air. The outer ear catches the waves, which then travel through a narrow passageway called the ear canal. The sound waves reach the eardrum, which is a membrane roughly half the size of a dime. They make the eardrum vibrate, which in turn vibrates 3 tiny bones called the malleus, incus, and stapes. These bones amplify or increase the sound vibrations and send them to the cochlea. The cochlea is shaped like a snail and is the size of a garden pea. It is filled with fluid, and the sound vibrations make this fluid ripple, which creates waves. Hair-like structures called stereocilia sit on top of hair cells and are grouped together as hair cell bundles inside the cochlea. The hair cells inside the cochlea ride these waves, and the hair bundles are moved. The hair bundle on top of the hair cell turns these movements into electrical signals. As the hair bundles are moved, ions rush into the top of the hair cells, causing the release of chemicals at the bottom of the hair cells. The chemicals bind to the auditory nerve cells and create an electrical signal, which travels along the auditory nerve to the brain. Different hair cells respond to different frequencies of sound. The hair cells at the base of the cochlea detect higher-pitched sounds, such as a piccolo or flute. The hair cells toward the top of the spiral detect progressively lower-pitched sounds, such as a trumpet or trombone. At the very top or apex of the spiral, the hair cells detect the lowest-pitched sounds, such as a tuba. The auditory nerve carries the electrical signal to the brain, which interprets the messages as sounds that we recognize and understand.
Classification of hearing impairment. The affected part of the ear is one basis for classifying hearing impairment. Conductive hearing loss occurs in the outer and middle ear, thereby blocking the passage of the acoustic energy. Blockage may be caused by abnormal growths or complications of the outer or middle ear. Impacted cerumen results from the excessive buildup of airwax in the auditory canal. Diseases of the middle ear can leave fluid or debris. Malformation, incomplete development, or abnormal growth and improper movement of the ossicular chains can cause conductive hearing loss. If the inner ear is intact, conductive hearing impairment can be corrected through surgical or medical treatment. A hearing aid is usually prescribed.
Sensorineural hearing impairment occurs in the inner ear. The sensitive mechanism and the auditory nerve may be damaged. When the cochlea is impaired, the neural energy delivered to the brain is distorted or not delivered at all. Audition does not take place and speech is not heard. Sensorineural hearing losses may be congenital or adventitious because of illness or traumatic incidents. Only a very small percentage of sensorineural deafness can be reversed by medical intervention.
Mixed hearing impairments results from a combination of both conductive and sensorineural hearing losses. Any dysfunction in the central auditory nervous system between the brainstem and the auditory cortex in the brain results in a central hearing disorder. Another basis for classifying hearing impairment is its being unilateral, present in only one ear, or bilateral, present in both ears. As mentioned earlier, deafness may be congenital or adventitious. The degree of severity of hearing impairment may be slight, mild, moderate, severe, and profound. Sound, measured in decibels, or units that describe its intensity, that is, its loudness or softness. 0 decibel or zero hearing represents the softest or faintest sound that a person with normal hearing can hear. 0 decibel is also called zero hearing threshold or audiometric zero. Larger decibel numbers represents louder sounds. Severity of hearing loss: slight 27 to 40 decibel, mild 41 to 55 decibel, moderate 56 to 70 decibel, severe 71 to 90 decibel, profound 91 decibel beyond. Here is a sample decibel chart. A whisper 5 feet away registers about 10 decibels. Conversational speech 10 to 20 feet away registers about 30 to 65 decibel. A running car registers about 65 decibel, while a motor or tricycle registers louder at about 85 decibel. A 10 to 16 wheeler truck registers from about 100 to 125 decibel and causes pain to the ears. Characteristics of person with hearing impairment. Deafness is described as an invisible handicapping condition because there are only a few physical and observable manifestations to indicate its presence, such as the absence of the outer ear, closed ear canal, and fluid discharge from the ear. Some of the observable behavior and learning characteristics of a child with hearing impairment are as follows. Cups hand behind the ear, cocks ear or tilt head at an angle to catch sounds, has strained or blank facial expression when listening or talked to, pays attention to vibration and vibrating objects, moves closer to the speaker, watches face, especially the mouth and the lips of the speaker when talked to, less responsive to noise, voice, music, and other sources of sound, uses more natural gestures, signs, and movements to express self, shows marked imitativeness at work and play, often fails to respond to oral questions, often asks for repetition of questions and statements, often unable to follow oral directions and instructions, has difficulty in associating concrete with abstract ideas, has poor general learning performance. Here, we can see the American Sign Language alphabet, in short, ASL. ASL is a rich visual manual language. It is primarily used by the deaf individuals for communication, conveys meaning through hand shapes, movements, and facial expressions. It is also called fingerspelling alphabet. Spells out words using distinct hand gestures for each letter. Complements ASL for names and unfamiliar terms. Essential for comprehensive communication.
And now I will be discussing the identification and assessment of children with hearing impairment. Hearing impairment means having partial or total difficulty hearing sounds, which affects how a person communicates and develops language. It can be congenital, present from birth, or adventitious, developed later in life due to illness, injury, or other causes. Importance of early identification. Finding hearing problems early is very important because it allows children to get medical treatment right away and receive special education support sooner. Assessment usually includes audiological evaluation. It is a testing hearing ability, cognitive assessment, checking thinking and problem solving skills, communication assessment, evaluating how the child speaks and understands language. Audiological evaluation. This is the scientific way of checking how well a person can hear. It's done by an audiologist using an audiometer that plays different sounds. Common tests include pure tone audiometry, checks how a child hears tones through air or bone. Speech audiometry tests how well the child hears and understands spoken words. Other tests, like sound field play or behavior observation audiometry. Informal tests in the Philippines are whisper test, the child repeats whispered words, conversational live voice test, checks if the child can hear at different loudness levels, ballpen click test, the child identifies the sound of a pen click near the air. Second, we have cognitive assessment. This test measures the child's intelligence and problem solving without depending on hearing. Common tools include HISKI test, Wishler Intelligence Scale for Children, and Stanford Achievement Test, or nonverbal parts. Assessment of communication abilities. This focuses on how well the child uses language in form, content, and purpose, pronounces words, controls voice, pitch, and tone. It helps teacher and speech therapists plan activities to improve the child's communication skills. Fourth, we have social and behavioral assessment. Hearing loss can affect how children interact and feel about themselves. They may have trouble communicating with classmates, feel shy, isolated, or frustrated, develop low self confidence, or emotional difficulties. Teachers and parents must support them by building inclusion and understanding. Educational placement. The child's degree and type of hearing loss determine the right educational setup. In the Philippines, most students with hearing impairment are mainstreamed in regular classes and may receive help from a SPEd teacher, a sign language interpreter, special lessons such as oral communication, total communication, auditory verbal training, and cued speech. Second, we have support services. To help them learn effectively, students may use sign or oral interpreters, computer aided instruction or CAI, closed captions on videos, text messaging or telecommunication devices for communication. Suggestions for teaching students with hearing impairment. First, we have promote acceptance. Welcome the student warmly. Explain their condition to the class positively. Treat them naturally, focus on what they can do, and talk openly with the student to build trust. Second, use hearing aids and devices. Ensure they wear and care for their hearing aids. Understand that hearing aids make sounds louder but not always clearer. Educational approaches used when working with students with hearing impairment. We have bilingual bicultural, total communication, and auditory oral. Bilingual bicultural recognizes ASL as the language of deaf culture and English is a secondary. Total communication uses multiple techniques to support communication and comprehension. Auditory oral develops listening and oral English skills using residual hearing and training. And also, we have to ensure the special education teacher checks that the student's hearing and or device properly. Encourage the student to care for it, report any problems, keep a spare battery at school, and inform the teacher or parents if the device isn't working. Third, we have provide preferential seating. Sit the student near the teacher. Make sure they can see your face clearly. Keep them away from noisy areas and glare. Allow them to use their better ear when listening. Fourth, we have increased visual information. Face the class when speaking so they can lip read. Don't talk while writing on the board. Use visual aids like pictures, charts, and gestures. Avoid standing in front of windows. Fifth, minimize classroom noise. Keep the room quiet during lessons and wait for the silence before giving instructions. Sixth, we have modified teaching methods. Make sure the student is looking before you speak. Rephrase instructions if needed. Write keywords or new terms on the board. Assign a buddy student to assist. And pre-teach new vocabulary before lessons. And lastly, we have realistic expectations. Be patient. The student may miss some information. Give short breaks when they seem tired. Expect them to follow class rules and responsibilities, and report any changes in hearing to the SPEd teacher. In summary, children with hearing impairment can learn and succeed like everyone else. With early detection, proper assessment, and inclusive teaching, they can build strong communication skills and confidence. Teachers, parents, and classmates play a vital role in supporting their learning and emotional growth.